You go to bed like every other night, but the next morning something feels wrong. Your arm won't lift, your words are slurred, and your head is spinning. No accident, no warning, just an ordinary morning turned into a nightmare. This happens to thousands of older adults each year, not from smoking or bad diet, but from a habit they believed was healthy, taking daily vitamins. What no one told them is that some vitamins, if taken at the wrong time or in high doses, can quietly push the brain into a dangerous state. As a neurologist, I've seen strokes triggered by high-dose vitamin D and brain bleeds caused by improper use of vitamin E. Studies from the NIH and Mayo Clinic show seniors over 60 are at much higher risk when taking these vitamins without proper monitoring. In this video, I'll walk you through 5 vitamins you should recheck today, and safer ways to use them to protect your memory, stabilize blood pressure, and keep your blood vessels flexible while you sleep. This knowledge could help you avoid a sudden stroke. If you or a loved one takes vitamins daily, comment below with the ones you use. And don't forget to like and subscribe to Senior Health Insights, so you never miss important warnings made just for people over 60. Vitamin D, silent stroke trigger. Many seniors take vitamin D daily to protect their bones, boost energy, or improve mood. But after 60, your body processes vitamin D differently. If taken in the wrong amount or at the wrong time, especially at night, this well-meaning habit can quietly stiffen your arteries, raise calcium dangerously, and trigger a stroke in your sleep. No pain, no warning, just one morning everything changes. A 2021 study from the University of Copenhagen found that seniors taking over 4,000 IU of vitamin D daily had a 42% higher risk of vascular calcification within 6 months. Vitamin D increases calcium absorption in the gut. When blood calcium rises too high, your body deposits it into soft tissues, including arteries, making them stiff and narrow. According to the Mayo Clinic, this arterial rigidity significantly raises the risk of clot formation and ischemic stroke. Worse, the risk increases if vitamin D is taken before bed when the body is less active and calcium clearance slows. NIH now recommends 1,000 to 2,000 IU per day max for adults over 60, only if deficient. Here's how to safely integrate vitamin D into your routine. Step 1. Get tested. Ask your doctor for a 25-hydroxy-D blood test to check your current vitamin D level. Step 2. Choose the right dose. If you're not deficient, 600 to 800 IU per day from food is often enough. If supplementing, choose a dose under 2,000 IU per day. Step 3. Morning only. Take vitamin D with breakfast. This aligns with your body's natural rhythm and supports better calcium metabolism. Step 4. Pair with magnesium. Magnesium helps your body process vitamin D more safely. Consider adding leafy greens seeds or a low-dose supplement. Step 5. Review other sources. Multivitamins, fortified milk, and some protein powders also contain vitamin D. Check your labels to avoid overlap. Integrate it. Simply line up your morning pill organizer, add it to breakfast, and review everything once per year with your doctor. Mr. Walter, 74, a retired Navy veteran, took 10,000 IU vitamin D daily for years, thinking it protected his bones. But after a mild stroke during sleep, doctors found severe calcification in his arteries. After reducing his dose to 1,000 IU and switching to morning intake, his blood calcium normalized within 2 months. He now walks daily and helps educate others at his senior center. If you take calcium supplements, heart meds, or have kidney issues, always consult your doctor before adding vitamin D. Some medications, like thiazide diuretics, can increase the risk of vitamin D toxicity. Seniors with limited sun exposure may benefit, but only under supervision. Vitamin E, the bleeding risk no one warns you about. Vitamin E is often called the heart helper. Many seniors take it hoping to boost memory, improve circulation, or protect their skin. But after 60, especially when combined with blood thinners, high-dose vitamin E may quietly increase your risk of internal bleeding and, in the worst-case scenario, cause a hemorrhagic stroke. No warning signs, just one fragile vessel in the brain gives way. According to a 2014 meta-analysis published in the journal Food and Chemical Toxicology, daily vitamin E doses over 400 IU were linked to a 13% increase in hemorrhagic stroke. The mechanism, vitamin E, acts as a natural anticoagulant, slowing blood clotting. For seniors already on medications like warfarin, aspirin, or Plavix, this effect can tip the balance too far, leading to spontaneous brain bleeds without trauma or high blood pressure. The American Heart Association warns against high-dose vitamin E supplementation for those with cardiovascular conditions. The recommended intake, just 15 mg per day, roughly 22 IU, yet most store-bought supplements contain 200, 400, or even 1,000 IU. Here's how to safely manage vitamin E. Step 1. Check your labels. Look for DL-alpha-tocopherol or natural vitamin E, and note the IU count. Step 2. Skip high-dose pills. If your supplement contains over 100 IU, reconsider, especially if you take any blood thinner. Step 3. Get your E from food. Almonds, sunflower seeds, spinach, and avocado are rich in vitamin E and easier to regulate. Step 4. Consult before combining. If you're on medications affecting clotting, show your doctor all supplements you're taking. Step 5. Space out dosing. If advised to take vitamin E, separate it from heart meds by a few hours to reduce interactions. Bonus tip: store natural vitamin E in the fridge to preserve potency and prevent oxidation. Always aim for balance. Your body needs vitamin E, just not in megadoses. Mrs. Evelyn Brooks, 81, took a 800 IU natural vitamin E supplement daily, believing it would help her memory. 3 weeks later, she was rushed to the ER with a severe headache and confusion. A brain scan revealed internal bleeding. Doctors removed the supplement, adjusted her medications, and she recovered slowly. Today, she educates others. I thought it was harmless. I didn't know I was thinning my blood too much. Avoid vitamin E supplements if you're on blood thinners, have bleeding disorders, or a history of stroke. Always consult your doctor before adding vitamin E to your routine. Choose food sources whenever possible. They're safer, more bioavailable, and less likely to disrupt medications. Vitamin B6, the brain booster that damages nerves. Vitamin B6 is often praised for supporting nerve function, memory, and mental clarity. But for seniors, long-term use in high doses may quietly do the opposite, causing tingling, numbness, balance problems, and even permanent nerve damage. The scary part: these symptoms creep in slowly. So many older adults confuse them with arthritis, aging, or early dementia, never suspecting the supplement itself. According to the National Institutes of Health, vitamin B6 toxicity begins to occur at doses above 100 milliliters per day. In older adults, excess B6 accumulates and can damage the myelin sheath, the protective coating around nerves, similar to stripping insulation off electrical wires. A 2017 study in the Journal of Clinical Neurology found that 18% of seniors with unexplained neuropathy were unknowingly taking high-dose B6 supplements. Even worse, B6 toxicity may be irreversible if left unchecked. Most multivitamins contain small amounts, but many brain health or nerve support formulas online contain 50 to 200 milligrams per capsule, often marketed as safe or natural. Here's how to use B6 wisely. Step 1. Identify all sources. B6 hides in many products, multivitamins, energy blends, and fortified cereals. Step 2. Keep it under 10 milligrams daily. Seniors only need 1.7 milligrams per day. Safe upper limit is 100 milligrams per day, but staying under 10 milligrams avoids buildup over time. Step 3. Eat your B6. Chickpeas, tuna salmon, bananas, and spinach are great sources. Step 4. Avoid long-term nerve formulas. Many support pills add B6 in high doses. Check the label and cycle off every 3 months. Step 5. Watch for symptoms. Tingling, burning feet, poor balance, or hand numbness. Check your supplements immediately. Simple swap: replace nerve pills with a B complex that has less than 5 mg B6, or switch to food-based blends. B6 is essential, but too much, especially for too long, is a risk not worth taking. Mr. Harold Jenkins, 76, took a brain support supplement with 100 milligrams of B6 twice a day. After several months, he noticed tingling feet and poor balance. At first, he blamed aging. Then, he fell in the bathroom. His neurologist identified B6 toxicity and stopped the pills. Within weeks, his symptoms improved. "I thought I was helping my brain," he said, "but I was poisoning it without knowing." Seniors with diabetes, neuropathy, or on anti-epileptic medications should be especially cautious. B6 can interact with drugs like levodopa-phenytoin or isoniazid. Always review supplement doses with your doctor, especially if you feel off but can't explain why. Vitamin A, vision support that pressures your brain. Vitamin A is known for supporting vision, immune health, and aging skin. But for seniors, too much vitamin A can quietly build up in the body, raising pressure inside the skull, damaging brain tissue, and even mimicking the symptoms of a stroke. You might think you're helping your eyesight, but you could be setting the stage for headaches, vision loss, and cognitive decline. Vitamin A is fat-soluble, meaning it gets stored in the liver, brain, and fatty tissues. Unlike vitamin C or B6, it doesn't flush out easily. A study from the American Journal of Clinical Nutrition found that older adults taking over 5,000 IU per day for more than 6 months had a 3-fold increase in intracranial pressure symptoms. This condition, called pseudotumor cerebri, mimics a brain tumor, causing headaches, nausea, blurred vision, and balance issues. Seniors are especially vulnerable because liver function slows with age. According to the NIH, the safe upper limit is 3,000 IU per day, but many skin and anti-aging supplements exceed 10,000 IU without warnings. To avoid vitamin A toxicity: Step 1. Review your supplements. Look for retinol palmitate, retinol, or beta-carotene on the label. Step 2. Calculate your total intake. Multivitamins, eye formulas, and skin supplements often overlap. Add them up. Step 3. Stay under 2,500 IU per day. If you eat liver, take cod liver oil, or use fortified foods, be extra cautious. Step 4. Go food first. Get vitamin A from sweet potatoes, carrots, spinach, and cantaloupe. Your body converts beta-carotene as needed, much safer. Step 5. Cycle off. Avoid using high-dose supplements year-round. Take breaks and check with your doctor regularly. Bonus: if you take zinc, it helps vitamin A work more efficiently, meaning you need less of it. Vitamin A is vital, but in the right form at the right amount and never in excess. Miss Dorothy Simmons, 79, took a high-dose skin and eye formula for 5 years, nearly 10,000 IU daily. She began having headaches, blurry vision, and dizziness. Doctors feared a stroke, but scans showed elevated intracranial pressure from vitamin A buildup. They stopped the supplement and started pressure-reducing treatment. She now takes food-based sources only and reminds others, "Too much of a good thing nearly stole my sight." Avoid high-dose vitamin A if you have liver disease, glaucoma, or take retinoid medications. Pregnant women should also be cautious. Always consult your doctor before combining multiple vitamin A sources. Choose beta-carotene-based products. They're safer and less likely to accumulate. Vitamin B3 niacin, from heart health to stroke risk. Niacin, also known as vitamin B3, is widely used to improve cholesterol and heart health. But in high doses, especially for older adults, it can do more harm than good. Niacin may cause rapid blood vessel changes, sudden blood pressure spikes, or heart rhythm disruptions. And when taken daily without medical oversight, it can lead to a mini-stroke or full ischemic event without warning. A 2016 study in Circulation found that seniors taking more than 1,000 milliliters of niacin daily had an elevated risk of atrial fibrillation and blood pressure instability within 3 weeks. Niacin causes vasodilation, temporarily widening blood vessels, which explains the flushing or heat sensation. But soon after, vessels constrict again, creating a yo-yo effect on circulation. This can reduce blood flow to the brain and trigger transient ischemic attacks, TIAs. The American Geriatrics Society warns that extended release or flush-free niacin can still have these effects. Most older adults need no more than 14 to 16 milligrams per day, yet some supplements contain 500 to 2,000 milligrams per dose. To use niacin safely, Step 1. Check your supplement label. Look for nicotinic acid niacinamide or inositol hexanocotinate. Step 2. Avoid megadoses. Anything over 50 milligrams per day should only be taken under supervision. Step 3. Watch for symptoms. Flushing dizziness, rapid heartbeat or blood pressure swings may signal niacin overload. Step 4. Stick to food. Niacin is abundant in chicken, turkey, salmon, brown rice, and peanuts. Step 5. Cycle off. Don't take high-dose niacin continuously unless your doctor prescribes and monitors it. Bonus tip, space it away from blood pressure meds or heart drugs by several hours. And remember, there are safer ways to support heart health like fiber, omega-3s, and walking. Niacin isn't inherently bad, but it's powerful, and seniors need to respect the dosage. Mr. Frank Miller, 82, took a heart supplement with 1,000 ml niacin twice a day. He began having morning dizziness and face flushing. His family thought it was anxiety until he experienced slurred speech for 2 minutes. Doctors diagnosed a TIA caused by niacin-related blood pressure swings. He stopped the supplement and recovered fully. Now he reads every label and takes just 15 milligrams niacin from food. Avoid high-dose niacin if you have high blood pressure, arrhythmia, or diabetes. Niacin can interfere with blood sugar, liver enzymes, and heart rhythm. Always consult your doctor before starting any supplement over 50 milligrams, especially if you're over 60 and take prescription medications. We've just uncovered 5 vitamins D, E, B6, A, and B3 that may quietly raise your risk of stroke, nerve damage, or internal bleeding after age 60. These aren't bad vitamins, but when taken at the wrong dose at the wrong time or in the wrong combination, they can harm instead of help. You want to stay sharp, mobile, and independent, and now you know the real risks hiding in your supplement drawer. Start by reviewing just 1 bottle today, vitamin D. Check the dose, the timing, and whether you truly need it. Then, over the next week, scan through your entire supplement stack, multivitamins, nerve pills, heart blends. Write down anything over the recommended dose and talk with your doctor at your next visit. Keep a small notebook labeled My Safe Supplement Plan and update it twice a year. This small habit could protect your brain, your balance, and your independence. Subscribe to Senior Health Insights now to get weekly science-backed guidance made for adults 60+. Every video could be the one that helps you or someone you love stay safer and stronger. Thank you for spending time with us today and for caring enough to take control of your health. Next week, the hidden side effects of common blood pressure medications after 60. Join us as we break down real stories, practical alternatives, and what your doctor might not have mentioned. You won't want to miss it.